All right, so it looks like it's 10 a.m. on the dot, and I think that we will get started here. We'll probably have a few more people join as we start the webinar, but I want to welcome everyone to the March webinar, our membership orientation. My name is Tina Papp. I am an outreach specialist here at the Wisconsin Cancer Collaborative. And I just want to welcome you all. This webinar will feature a lot of what your membership entails and what the Cancer Collaborative can provide to you as a member. We're going to do a little bit of an overview of our agenda here. So we're going to go over the Wisconsin Cancer Collaborative structure. We'll go over the Wisconsin Cancer Plan. We'll actually go into our website and show you how you can use the plan on our website and how interactive it is. Some of you have probably not even been on that part of our website, so we're excited to show you. We'll go over the member benefits and also show you some examples of the Wisconsin Cancer Plan in action from some of our members who have taken things from our plan and actually put it into their work that they have done. And then we will save some room for questions at the end. So let's talk about comprehensive cancer control. So the Wisconsin Cancer Collaborative is a comprehensive cancer control program. Comprehensive Cancer Control, or CCC for short, is a national movement. It is a collaborative and strategic approach that brings partners together to combine, share, and coordinate resources to reduce the burden of cancer across the whole cancer continuum from prevention through end of life. In 1998, CDC established the National Comprehensive Cancer Control Program, NCCCP, to support this wide-ranging and inclusive effort. The program provides funding and technical support for the development and implementation of CCC plans. These plans guide the work of many and focus on current and emerging cancer issues, including cancer prevention, early detection, treatment, rehabilitation, and survivorship. Today, CDC funds cancer control programs in all 50 states, the District of Columbia, 7 tribes and tribal organizations, and 7 U.S. territories. With this funding, the programs create and maintain coalitions, look at the cancer burden in their area, prioritize proven strategies for cancer control, and create cancer plans and to put them in action. So what is the Wisconsin Cancer Collaborative? I'm going to go over who we are, what we do, our mission, vision, and goals, and kind of just show you a little bit about us. We are a statewide coalition of 180 organizations and a little over 500 members. This has grown significantly in the past few years. So we thank you all for joining and sharing, what we do and getting our colleagues to join and all of that. The collaborative provides credibility and importance to cancer issues. We convene expertise and resources at the same table. We garner widespread support across many sectors and leverage partner strengths, relationships, and networks. We connect our members with tools, support, and knowledge they need to create healthier communities. All of our work is guided by the Wisconsin Cancer Plan, which we'll go over here in a few minutes, which acts as a blueprint for action. The Wisconsin Cancer Plan combines best practices, reliable data, and concrete action steps for health system leaders, public health advocates, policymakers, researchers, and all other Wisconsinites engaged in cancer work. So I'll talk about our mission, vision, and goals now. Our vision, a healthier Wisconsin by reducing the burden of cancer for everyone. Our mission, to engage diverse partners to develop, promote, and implement a statewide comprehensive approach to cancer control. And our approach, use and establish evidence-based sustainable solutions to reduce the burden of cancer in Wisconsin through policy and systems level change. With that, I would love our staff to come off screen and introduce yourselves. We will go in order of all the pictures on the screen to just kind of make it easier, but these are the people that everyone should be contacting and working with and asking questions. So if you know any of these people on the screen or have worked with them, please give a shout out. And also, please share the work that you're working on and the things that you do, so that way people in the webinar can feel free to reach out to you. We'll provide emails and all of that in our webinar follow-up too. So go ahead, Beth.
Thanks, Tina. Beth Brunner. Thank you, everyone, for joining today. I'm so excited to be able to share the great work of this team and the collaborative and all the members have been working so hard on over the years. So as the director, one of the things I do is I work directly with our steering committee. So if you have any questions about that, I also do some more of the strategic engagement and some of our partnerships, but I am one you can always reach out to if you have questions on any aspect of the collaborative, whether it's the program and the work we do at the CDC or any of the outreach that we do when working with our members. So again, just so happy to have you all here, and always feel free to reach out if you have questions. Thanks, Tina. Maybe I'll go. I don't know if Dr. LeConte is on today. Otherwise, Allison.
I'm here, Beth.
Wonderful. Thank you.
Noelle LeConte. I'm a medical oncologist at UW-Carvone. I've been with the collaborative since 2011. Just provide strategic oversight to the program and focus on treatment and also cancer screening efforts. Thanks for joining.
Hi, everybody. I'm Allison Antoine. I am the outreach manager, and I see several familiar names and some faces with the pictures in our participant list. So I'm excited to see many, well-known names and also some new names this morning. In my role as the outreach manager, I work very closely with Beth and also Dr. LeConte, as well as the rest of our team, as we try our best to do outreach and really do some strategic outreach all across the state. And like Beth said, I'm someone that you can always reach out to and send an email or a question, even if you're not quite sure, who might be the best person on our team to reach out to. We're always happy to connect and really help out as in whatever way that we can. And I will pass the intro mic next to Amy Johnson.
Good morning, I'm Amy, and I'm the policy coordinator for the collaborative. My work focuses on all levels of policy for governments and for healthcare, anything that impacts the cancer prevention and control. And I also staff the policy committee. I'll turn it over to John.
Good morning, everyone. John Krebsbach. I am an intern with the Cancer Collaborative. Kind of have my hands in a lot of different pots, if you will. Some community engagement stuff, also with some research stuff. I'll pass it to Tina.
Hi again, I'm Tina Pappen, outreach specialist for the Cancer Collaborative. My main focus is events and membership. So if you have any questions about being a new member or anything that we can help you with, please let me know.
Good morning, everybody. My name is Alex Faust, and you will hear more from me shortly here in this presentation. But I am also an outreach specialist with the collaborative, and I work on areas of cancer risk reduction. So my main focuses right now are around alcohol, tobacco, physical activity, healthy eating, but then I also sometimes touch those other topics like UV exposure, radon, and all of those other priorities that are in that risk reduction chapter. And I will pass it along to Alexandria next.
Good morning, everybody. I'm Alexandria Culweatherer, and I'm an outreach specialist, and I focus mainly on cancer survivorship and then also cancer prevention vaccines, so hepatitis B and HPV. And so if you have any questions on those topics, feel free to reach out to me. I'm always happy to brainstorm or hear about the work that you're doing, so thank you. And I'll pass it on to Mary.
Good morning, everyone. My name is Mary, and I am an outreach specialist with the Cancer Collaborative. My main focuses are in data and evaluation, but also some screening, and I also dabble a bit in radon as well. And so any questions regarding any data that you see on the website, more than happy to help out, or if you're looking for data and can't find it, again, reach out and I will be glad to help.
Thanks, staff, for introducing yourselves. And thank you, Tina, for handling that first part of the presentation. I'm going to take over now and talk a little bit more about the structure of the collaborative. And so in addition to our staff, the collaborative is also guided by both a steering committee and a policy committee. The steering committee provides leadership and guidance to our membership in their efforts to implement the Wisconsin Cancer Plan. In doing so, the steering committee serves 2-year terms to guide membership recruitment and engagement activities, as well as the resources provided to members to support their Wisconsin Cancer Plan implementation efforts. The steering committee is staffed by our Beth Brenner and currently chaired by Paula Silla. If you'd like to view all of our steering committee members, you can follow this link that's in the slide when we send these out in the follow-up. The other committee that helps guide our work is our policy committee. And so the Wisconsin Collaborative's Policy Committee develops and promotes a biennial policy agenda that supports the Wisconsin Cancer Plan 2020-2030. The Policy Committee educates our membership about the connections between public policy and cancer control and helps our members take action to advance the policy agenda's goals. Policy Committee members monitor emerging issues at the local, state, and federal level, advise the development of policy-related resources, and provide guidance to our members and staff. The Policy Committee is staffed by our Amy Johnson and chaired by Dr. Kurt Edel. And you can view the policy agenda and all of our policy committee members at this link. And again, we will send that out in our slides after the presentation. All right, so now I'm going to talk a little bit more in depth about our Wisconsin Cancer Plan. And Tina already touched on it briefly, but I am really going to dive into all of the different components that make it. So the Wisconsin Cancer Collaborative coordinates and develops the Wisconsin Cancer Plan and promotes the implementation of it. The Wisconsin Cancer Plan 2020-2030, and from now on out, I'm just going to refer to it as the plan. So the plan lays forth a blueprint for action with a singular vision, creating a healthier Wisconsin by reducing the burden of cancer for everyone. It spans the entire cancer control continuum from risk reduction through end of life. The success of the Wisconsin Cancer Plan depends on people and organizations from multiple sectors coming together to take action. Organizations can look to the Wisconsin Cancer Plan for evidence-based, sustainable solutions to reduce the burden of cancer in their communities and across the state through policy and systems level change. The plan includes a framework that encompasses the vision, mission, and overarching goals across 7 chapters. Each chapter includes priorities, strategies, and specific action steps. The plan combines best practices, reliable data, and those concrete action steps, and is designed to serve health system leaders, public health advocates, policymakers, researchers, and every Wisconsinite working to prevent cancer and improve health outcomes. It contains proven tools to expand your impact and to make the most effective impact on the cancer burden in your community. You can use the cancer plan for best practices and strategies to guide your work, for looking for reliable data, for those concrete action steps, different progress measures, and related resources to support and expand your impact. It also contains expert guidance across that cancer care continuum. It was designed by experts to offer strategic guidance in health equity, risk reduction and prevention, screening and early detection, treatment, survivorship, end of life, and access to quality data. So these are the overarching goals of the Wisconsin Cancer Plan, and you can see they mirror those 6 things I just listed off right before, and they're to advance health equity as it relates to cancer, reducing the risk of developing cancer, detecting cancer at the earliest stage possible, reducing death and suffering from cancer, improving the quality of life for cancer survivors, and then finally, improving the quality and use of cancer-related data. And so these are the 7 chapters of the plan. As mentioned earlier, each chapter contains a list of priorities along with action steps and data measures that aim to evaluate our state's progress towards that area. Let's quickly take a look at what the cancer plan looks like online. So I am going to exit out of these slides and I'm going to bring us to our website now. And so one moment. There, so you should be able to see my screen now. Once you get to our Wisconsin Cancer Collaborative website, you can easily navigate to the cancer plan by scrolling to this big tab here. So when you click on it, it will bring you to our homepage. And here you can see you have the option to view our plan online, the interactive version, or you can download the print version. The print version or the PDF version that you download does not contain all of the same elements that our interactive online one does, such as the action steps and the data measures. And so if you would like to explore this one on your own, feel free. We also have many, many copies available in our office. So if you would like to request your own print copy, that is definitely something we can get sent to you. But for now, we are going to take a look at our interactive plan. So when you get into our interactive plan, you can see our 7 chapters listed off here on the side. It will first take you to our intro page for the plan, where you can read about the vision, mission, and those overarching goals that I already discussed, and some more information about it. But for now, let's explore what a chapter looks like. So I'm going to click on Chapter 2, Risk Reduction, for an example. So when you click on the chapter, you again are brought to the chapter's intro page, where you can see all of the priorities listed out here at the top. So Chapter 2 has 6 priorities. And when you scroll down, there's a brief summary of the chapter with the main takeaway. And then also you will find a glossary of key terms throughout this chapter. And if you keep scrolling all the way to the bottom, you will also find the references that were used to construct this intro paragraph above. So let's explore what a priority looks like within the cancer plan. So you have the option of selecting from the top or the bottom here. For an example, I'm just going to click on priority 1, which is to decrease tobacco use and exposure. So when you enter into the priority, you can read it here at the top, and then you will see a list of strategies along with different action steps to obtain each strategy. So risk reduction priority 1 has ABC 3 strategies to address it, and then a whole list of action steps below. As you read through these action steps in the plan, you might realize or find that a lot of the work that you are currently doing already aligns with the plan, and that's awesome. That's what we like to see, and we call that the cancer plan in action. We are going to give some more concrete examples of this towards the end of our presentation today. But when you have some free time, take a moment to read through some of these and see how your work is currently aligning. So if you scroll through all of the priorities, at the bottom of each priority page, you will find a section called measures. And these are the ways that we are evaluating our progress towards achieving each of our strategies and priorities and chapters within the plan. So for our tobacco chapter, you can see we're measuring the percent of adults currently smoking cigarettes, e-cigarette use among youth. And then when you hover over the bar, you will see our data source for the measure and then a little bit more of a detailed description. And so this is kind of a high-level overview of how our plan works. If you are just interested in looking at those plan measures, there is a tab here on the left side where you can do that just to see the data organized by a chapter. If you would like to talk more about how you can better align your work with the Wisconsin Cancer Plan, or would like to share with us how the work you are already doing is within the cancer plan, we would love to hear that and find time to meet with you. So just keep that in mind as you are doing your work. We love to hear about the great stuff that's going on within our membership. And now I am going to navigate back to the slideshow. And I'm going to pick up from here. And I'm going to dive into the benefits of your Wisconsin Cancer Collaborative membership. So now that we have provided a background on what the collaborative is and the Wisconsin Cancer Plan, we're going to take a closer look at the many perks and benefits that a Wisconsin Cancer Collaborative membership offers. So as a member of the Wisconsin Cancer Collaborative, you have access to our networking directory, monthly and quarterly members only newsletters, email alerts, free access to our events, different opportunities to be involved with leadership, tools and resources to support your organization's efforts to implement the Wisconsin Cancer Plan, and also opportunities to collaborate with other members within the collaborative. And I'm going to kind of dive into each of these benefits in a little bit more detail now. So one of our best features of the membership to the collaborative is access to our members only networking directory. When you log into your profile on the collaborative website, you'll be brought to our member center. Here you can see a list of our member organizations, their social media profiles, a helpful FAQ document, and finally, our member directory. If you have never logged into your profile or need help logging in or setting that up, Tina would be more than happy to help walk you through that. So if this is looking new to you and you need some help, definitely reach out to Tina. So for now, I'm going to navigate back to our website and dive into each one of these sections to show you just how helpful they can be in your work. So once you get back to our website, you can find the Member Center up here at the top. And if you are not logged in already, it'll just have you log in by entering your username and password. So we made it to our Member Center. And first, I'm going to dive into our networking directory, which is right here. So when you click View Members, you'll be brought in and can see a long list of everybody who's currently signed up. If you are looking to filter and find people who are working on a certain priority or different action area that you can do so by filtering by cancer plan priorities. If you're looking for a member working in a similar area as you can filter by counties. And then you can also search by the different populations that members indicate they serve. So for example, let's click on a profile and show you what it looks like. And we will take a look at our Allison Antoine's profile. So when you click on it, you'll be able to find their contact info, their title, phone numbers, and then you also can see the priorities that they list that they work on. Most people upload a picture of themselves, and then you can see the organization that she works for that I think needs to be updated yet, and then the counties that she serves and the populations that she serves. I'm going to navigate back to the Member Center to show you the other features that exist in it too. We also have a list of all of the organizations within the collaborative as well. This is really handy if you're looking to connect with an individual at a specific organization. So say you are really looking to connect with somebody at the American Cancer Society. It'll show you all of our members who are part of that organization. So we make it really easy to find those contacts if you are looking for them. And then I'm going to go back to our Member Center again. And then one of the other blocks we have here is our social media connections. This is a list of all of our member organizations' social media contacts on Facebook, Instagram, LinkedIn. So if you are looking to follow some different groups on your socials, this is a great way to find those. And then finally, we also do have a Member Center FAQ document. So if you are just looking for a quick question to be answered, this is always a great place to turn to. Otherwise, again, Tina is more than happy to answer any of your questions around membership. And so while I'm on our website, the next benefit that we want to talk to you about your membership is about our monthly and quarterly newsletters. And so if you are a member, these get sent directly to your inbox every single month. We have our monthly newsletter, Engage, which just went out yesterday. You may have seen that. And then we also have our quarterly newsletter, the Policy Review, formerly known as the Policy Roundup. For some reason, if you missed the newsletter or it got sent to your junk, you can find them online by going to our About section and then the newsletters. So like I said, Engage is our monthly newsletter that delivers cancer control news, resources, and networking opportunities that our members need. It contains the latest tools, events, data, and more that can help inform your work. If you have a resource or announcement or event to share in Engage, please let us know. We're always looking to feature the things that are going on within our members' work. And then our policy review is put out quarterly. This is an easy to read snapshot of cancer-related policy issues that can affect your work and your community. Each issue includes a review of state and federal legislation currently being tracked and related resources for learning more. And the next feature I am going to show you on our website is our Resource Center. So if you have not checked out our Resource Center yet, this is a really great place to turn to whenever you are looking for any sort of cancer-related tool. So we offer resources designed to help healthcare providers, public health advocates, researchers, local coalitions, direct service providers, and others working to reduce the burden of cancer in Wisconsin. You can use our resources to support local and statewide efforts across the entire cancer care continuum. Our Resource Center includes resources created by the Wisconsin Cancer Collaborative, as well as vetted resources from external partners. The resources featured here support the strategies and action steps within the Wisconsin Cancer Plan. Let's take a quick look at some of our resources and our Resource Center. So when you get to our Resource Center homepage, you can scroll down and you can find the Resource Center by hitting search here. Once here, you can filter by many different categories. So you can look for resources that we at the Collaborative created. You can also scroll down to filter resources by a target audience, by the action area, the language that they're in, the cancer type they address, keyword or topic in them, the type of resource you are looking for, the cancer plan chapter that it addresses. So there are many different filters that you can search by. And so this kind of houses all of the resources that we have on our website. But if you're looking for something more quickly and more specific, you can do so by hovering over our resources tab. And here you can see we have a page dedicated to our COVID-19 and cancer resources, our county cancer data profiles, which are under construction and will be coming soon. You will be getting an email update when those are ready to go. We have our how-to sheets. We have a whole selection of different issue briefs we've put out. And finally, we also have infographics available. And so those are the resources that we have available on our website, and we are always looking to add to this. So if you see something that is missing on here that you think would be really valuable to include, shoot us a message and we are happy to get that posted on here. So that concludes our resource section. And next, we are going to transition into talking about some of the really cool events that the Collaborative hosts. And to do that, I am going to hand it over to Tina once again.
Thanks, Alex. So let's talk about all the different events that we host here at the Collaborative. Can I just ask, if you have been to a Wisconsin Collaborative event, just type me in the chat box and maybe also list what event or events that you've been to, because I'm just curious to see how many of you have been to an event or maybe have not been. we just wrapped up our 2022 summit here in Madison, Wisconsin. So hopefully some of you have been there. Yeah, Meredith, you've been there. Let's see. Well, as we go through the different events that are listed on our website, feel free to just type in the chat box which events you've been to. And if you haven't been to one, hopefully we'll see you at one soon. The first thing that we'll cover on our website is the member events calendar. This is a super awesome feature that we have because obviously with us having more than 180 different organizations in the collaborative, we always want to share out your events that you have. As you can see here, we try to list as many events as we can. There's no limit to the amount of events that you list either. So if you have a webinar coming up, if you have a big summit or conference coming up, please, please, please email any of the staff members and let us know, and we'll add it directly on here, because this member events calendar will also connect to our newsletter. And Alex, correct me if I'm wrong, but I believe all of the events will be listed in the newsletter too for that month. So you'll kind of get double shout outs there. Awesome. I'm seeing a lot of other people comment. Oh yeah, Kim, we're bringing regional meetings back. So I'm excited to talk about that. So after the member events calendar, let's talk about webinars. As you all know, you're on a webinar right now. We used to host monthly networking webinars, and when you go out to our website, you can actually see the archive of all of our webinars from previous months and years, and we have tons of great information on these webinars. As Alex is going through here, we have survivorship, we have American Indian Cancer Foundation. We have so many great webinars on here, and you can view the slides, watch the recording, share with your colleagues. So please don't hesitate to go onto our website and look at all of these. And if you have questions about any of them, don't be afraid to reach out. So after webinars, let's talk about regional meetings. I am super excited to talk about regional meetings because we are coming back with them this spring. We hope to host 3 regional meetings, one in the La Crosse, Eau Claire area, one in the Waukesha, Milwaukee area, and one in the Fox Valley, Green Bay area. As of right now, we do have a date set for the Eau Claire and La Crosse area. That's May 19th. So for those of you that are in that area, please save that date and we hope to see you there. We'll have more information coming out on that soon. But if you have any questions, don't hesitate to reach out. Our regional meetings are great ways to connect with people that are close and local to you. It's also a great way to invite someone that is not part of the Cancer Collaborative to join, because this will kind of give them an inside look of, who's part of the collaborative, what we do. We hope to share a lot of work that all of you are working on during the regional meetings. So that way you can connect with people that are doing that work really close to you, which I know can be kind of difficult when, it's a statewide organization. So there's people doing things in Milwaukee that you'd like to connect with, and people that are doing things in northern Wisconsin that you'd like to connect with. So yeah, feel free to come to any of those regional meetings. We are looking forward to hosting them this spring. And last but not least, the Wisconsin Cancer Summit. This is our biggest event of the year, and we do host it annually. This past year was the first year we came back in person since COVID. And we hosted at the Edgewater. As I can see here, some of you did attend that, so thank you for coming. We do have a save the date out for this upcoming summit in 2023. As you can see, the save the date is on our webpage. We have a full web page dedicated to the summit. You can go back to previous summits and see who spoke at them. We do have slides listed. Yeah, as you can see, we have event recaps for all of them. So Cancer Survivorship was one, the Blueprint for Action was another one, Equity in Action. Yeah, there's really, really good information. And this is also such a good way to connect with people using those recaps, because a lot of our speakers are members of the Wisconsin Cancer Collaborative or people local to Wisconsin that you might want to connect with on the work that they're doing. But yes, please save the date for November 1st and 2nd of 2023. It'll be held at the Wilderness Resort in Wisconsin Dells. Registration is always free for members, so please come out. We would love to see you. And this year, we're going to be doing the power of action. Be inspired by the work and stories of people in your community. Learn about your role in the cancer plan and how to improve health outcomes in Wisconsin. If you have a great story to share from your work or know someone that has a great story to share of the work that they're doing here in Wisconsin, please, please, please email me. We would love to share your story at the Wisconsin Cancer Summit this year. Let's see. And I believe after this, we're going to go into our work groups. This is a great opportunity for those of you who are focusing on certain areas of work to get involved. There's 3 or 4 staff members that work specifically with these work groups, and Alex is going to dive into them.
Thank you, Tina, for recapping all of the great events that we have here at the collaborative. Like Tina said, I'm going to talk briefly about some exciting new work groups that the collaborative is convening. So another really great perk of membership is the opportunity to join these exclusive work groups that we are convening. Currently, we are in the process of facilitating 3 different ones, a lung cancer work group, a data work group, and also a survivorship community of practice, which is already been up and running for a little bit now. So our survivorship community of practice is a cohort of peers across the state working to improve cancer survivorship care for Wisconsinites. It's made up of a diverse set of 15 organizations with 36 sites participating, mostly health systems. Some of these organizations have well-established survivorship care programs, and some are new to the survivorship space. Kirsten Norsleen of Gildas Club Madison is our co-chair. They meet quarterly, and each site is working on their own individual work plans, addressing a gap area in survivorship care. The work originated from a 2020 survey of Wisconsin cancer treatment facilities, which helped determine cancer survivorship care practices across Wisconsin. Results were published in an article, The Current Status of Survivorship Care Provision at the State Level, a Wisconsin-based assessment. And I'm sure one of our team members can drop that link in the chat for you if you are interested in reading that survey. So the survey revealed gaps in survivorship care for mental health services, facility services, sexual health services, and exercise and rehabilitation services. We provide technical assistance and provide resources, support, and facilitation for the members. The goal of this group is to provide people with the space to pool resources and talk about survivorship care. If you are interested in joining this group for the 2024 session, please contact Alexandria Cullweatherer at her email, which is listed there on the screen. So our next 2 work groups that we are really excited to launch are our lung cancer and our cancer data. So this year in 2023, we are convening cancer control professionals to form these 2 different groups. The data work group will explore the state of cancer and other relevant data in Wisconsin to identify gap areas and also areas for growth. The lung cancer group will convene cancer control professionals to examine lung cancer in Wisconsin to identify and implement strategies to improve lung cancer screening and to reduce incidence and mortality. We anticipate some of the broad priorities of this lung cancer group to include commercial tobacco use, screening, data, and among others. So if you are interested in joining any of these, you can send emails to the contacts listed here on the screen to either Allison, Mary, or Alexandria, or you can really just send an email to any one of our staff members and we will get you connected to where you need to be. And so we just covered a lot of different perks and features of a collaborative membership and what the collaborative is. So before we start to wrap up, I just wanted to provide a brief recap of some of the highlights of what your membership offers. So there are many different ways that your work can benefit from a membership to the Wisconsin Cancer Collaborative, including access to that resource library, our monthly newsletter, our membership directory, access to our events, and by joining one or more of the work groups that we put on. And so to conclude, we wanted to wrap up this presentation by talking about some of our members' work and providing some real-life examples of the Wisconsin Cancer Plan in action. So the first one I am going to highlight is a program that was put out by Ascension Southeast Wisconsin. So they created a free 4-part nutrition series on healthy meal planning and physical activity educational series designed for people to make the most out of life after a cancer diagnosis. They made this available to any cancer survivor, anyone across this state, that they didn't even have to be a patient within Ascension. So this educational series that they created aligns with our Chapter 5 survivorship under Priority 3, Strategy A, which is to tailor cancer risk reduction messages and activities to meet the unique needs of cancer survivors. So this program they created is a perfect example of them putting the plan into action and creating this educational series specifically designed for cancer survivorship. The next example we want to highlight is Gilda's Club. So Gilda's Club Madison during the pandemic provided many support services virtually and continues to offer those across the state yet. So this programming is available to survivors and caregivers across the state, even beyond the Madison area. And so this is a great example of it aligning with our cancer plan, Chapter 4, treatment, under Strategy B, which is Priority 3 Strategy B, which is to increase the availability of non-clinical support services for survivors and caregivers. Gilda's Club expanding their network to reach statewide, really increase the availability of some of these services that are out there for survivors and caregivers. And then finally, the last example I will talk about today is about Prairie Ridge Health Center, which is a health center in Columbia County. So what they did was they incorporated colorectal cancer screening into their 2022 Community Health Improvement Plan. So their goal is to increase colorectal cancer screenings and to increase the percentage of residents who are up to date on their screenings. In their efforts to increase early detection and screening rates, they are going to be addressing many different priorities and many different strategies and action steps all across Chapter 3, which is early detection and screening. And so I just put a copy of their community health needs assessment here. And if you read the priorities here, you can see how some of them will be aligned. So that concludes our webinar today. We are so appreciative of your membership and for you taking the time to be here today, whether you're a longtime member and just needed a refresh, or you're new to the program and we're looking to learn more about what we have to offer. We are just really thankful for you and all of the work you do around the state to really reduce that burden of cancer. We do have plenty of time for questions today. So if you have anything you would like to ask any staff member, or if you would like to take a moment to share some of the work that you are doing or connect with anybody else on this webinar, now is a great time to do that, either coming off camera, unmuting yourself, or using our chat. So thank you.
Thanks, Alex. One question I forgot to ask earlier in the webinar was how long you have been a member for. So if you could just put in the chat how long you've been a member for. I'm just curious to see who on the chat might be the longest standing member that is with us today. Thanks for joining us today, Brianna. And Kim. Hi, Mitchell. Thanks for joining. Thanks, everyone.
And staff, if there is anything that I missed that you would like to add, feel free to come off and say whatever you need to say.
Oh, thanks, Rebecca. Feel free to ask any questions if you have any. We would love to have you.
I would like to just reemphasize that we love to hear about your successes and emphasize and share those with everybody. So if anybody does have success stories or things they like to promote or events or anything, we love to know those things and share those with the community and in our newsletters and things like that. So we really love to promote those things. So thank you.
Thanks for the reminder, Alexandria. With that, I'm also just going to note here, because I forgot to mention it earlier about our member events calendar. We do love to promote all events, except for the certain occasion when someone wants us to promote a fundraiser or anything that is related to lobbying. We actually are not allowed to post things like that. So all other events are on the table, so please send those our way. As much as we would love to share all of your fundraising events and things like that, we just cannot. But if you have questions, please let us know. I'm glad that this webinar was informational for you, I believe, Fazia. Thanks, Mitchell.
This is Beth. I just wanted to say, seeing as how it looks like it's a lot of new people too.
Yeah.
I know we've said it, but as Alexandria said, share your successes. Also, you can share your challenges. So if you're looking for a partner and maybe you can't find them in our membership database, so you are looking to get help with your colorectal cancer screenings in your community, reach out. There might be opportunities that we could have to partner with you, not just to get you connected with other organizations, but maybe there are some things we can do to support. So I always just want to let now, like, please reach out to us too if you're hitting some challenges or you're just looking for some additional partners, because we want to play that role too. And how can we help support your work?
Definitely. Thank you, Beth.
And I just remembered, I think we have a poll too that we can launch, right, Tina?
So it's a survey that will come up right at the end of this. So when the
Gotcha.
meeting is over, a survey will come up just asking you about the webinar and giving you an opportunity to ask any last minute questions as well if you have any for us. With that, I'm not seeing many questions pop up. So it looks like we did a good job covering everything. I'll give everyone one last opportunity. Does anyone have any questions about the membership or anything that we can help you with, or any of the work that we focus on, the cancer plan? Thanks, Cheryl. All right. Well, thank you all for joining us. I'm glad that this webinar was informational for all of you. We will have a recording up on the website. So if you know anyone that is on your team or someone that you know that just recently joined that wasn't able to attend, you can let them know that there is a recording and they can view that on our website. And as we've mentioned many times, our staff is more than happy to answer any questions and help you with what you need. So thank you so much.
Thank you.